Hi, I want to talk about burning pain, particularly between the shoulder blades. If you are experiencing this type of burning, aching, radiating, or just gnawing pain between those shoulder blades, hopefully this particular technique will really do you a lot of good. Now, there are many things that can cause burning in our shoulder blades, but primarily it has to do with poor posture, forward head carriage, rounded shoulders, sitting at a computer, being in a position for a long period of time in a hunched over position, something you're doing accumulatively over time. They call it cumulative trauma disorder. That's actually causing these muscles to contract, spasm, and developing many trigger points within those areas. Now, trigger points are these noxious points, these little nodule points in a muscle. There are hundreds of muscles in our body, and it can happen anywhere, but primarily in the lower neck, upper back area is one of the most common areas that we develop these particular trigger points, and primarily in the upper trapezius or middle trapezius muscle, which are these muscles. It's kind of like a triangular muscle that goes from the mid lower back, works its way up in the middle traps, between the shoulder blades, and in the upper traps, it attaches behind the skull at what we call the EOP, the external occipital protuberance. Now, when you look at this chart, you'll see that there are red areas, which are the painful areas that you're generally going to feel the pain in those particular areas or those points of the muscle, but you'll see those X's, and those X's are trigger points. So what you want to do is you want to place pressure upon those X's that will hopefully get rid of those red areas, which are your painful areas. So there are two different ways you can do it. You can take a golf ball, a tennis ball, you can lay on it and just hold it on that area, because you'll know that when you're lying on a trigger point, it's going to be very tender. If someone takes their finger and pushes a point behind in that muscle, it's going to be tender. So either you're going to lay on a golf ball, lay on a tennis ball, put pressure up. Maybe when you're up against the wall standing, you can put something in there and just apply pressure to the area and hold it there for a few minutes, and you'll see the pain will dissipate and it will actually release a lot of that muscle spasm and pain that you're experiencing. The other way, obviously, is a massage therapist, maybe a neighbor, a friend, a loved one. It doesn't matter. Maybe your child, but have them get in there with their thumb. They'll be able to feel a little nodule. You'll know when it's tender. Have them just hold that nodule, putting pressure in there for a minute or two, and that can relieve a lot of those spasm trigger points and a lot of the pain that you're experiencing. I hope it really helps you. Leave your comments below or any questions you may have for me, and please pass these videos on to your friends and family so they can be helped as well. Make it a great day. I'm Dr. Alan Mandell.